Right, okay, afternoon, everyone. So for the next couple of sessions, I'm going to be talking about sexual offenders. Now, I gave a warning at the beginning of the course, okay, that, some of the content might be upsetting. I'm going to give that reminder again because I'm talking now about a crime that might be closer to home, right? As we're talking about serial killers, for most people, even indirectly, that's something that's in the distance. But that's not necessarily the case with sexual offending. And so, if you ever do want to remove yourself from the lecture and then come back when you're ready, that's completely fine. I'm going to begin by giving you a scenario. I want you to read it over and then follow the link on the slide. And it will give you a question on whether you think rape has occurred or not, and then just simply give your vote. Okay, most of you had a chance to do that? Okay. So, I've used this same poll from other semesters, which is why there's so many votes. But okay, the vast majority of you have said that it's rape. The reason is, right, that consent hasn't clearly verbally been given, and also consent can be revoked also at any point. There is a video here on the slides. It's a video that's quite frequently shown in colleges and schools in the UK. I'm not so sure about here in the US. So maybe you're familiar, maybe you're not, but I think it sums up the issue quite well and is worth checking out. So, when I'm talking about sexual assault, what I'm talking about is when the victim has not consented to sex. This also includes statutory rape, okay, in which the victim is too young to have given valid consent, or maybe doesn't have mental capacity to give valid consent. Now, unfortunately, it's not an infrequent issue. About 19% of college women say that they experienced sexual assault during their time at college. The Rape, Abuse, and Incest National Network here in the US estimates that sexual assault is committed every 68 seconds in the USA, and that 91% of victims are females. And then the CDC estimates that about 18% of women and about 1.5% of men will be raped at some point in their lives. Looking at the percentages of when rape most frequently occurs, okay, also tells us something. So 83% of cases, again and again across studies, about 80% of the time, the victim knows who her perpetrator is in a rape case. Most of the time, rape occurs in the perpetrator's home or the victim's home or within a shared home. It's only in the minority of times it takes place in a party, vehicle, outdoors, or at a bar. A large number of rape cases also go unreported, rather. So the number is also an underreport. In some questionnaires, victims of rape have said that they came forward to police after 2 years, about 32% of the time. About 20% said after 10 years, and about 22% said never. Which again is a common finding across studies that about 20 to 25% of women who self-reported to have been sexually assaulted never reported the assault. Part of why maybe victims don't come forward is that they don't want to go through the traumatic experience of a criminal trial, having to confront their abuser, having their name potentially reported out in public. But also, unfortunately, there are rape myths. They're still common within the public and also amongst jurors. These are some of the most common rape myths that still exist. First of all, that sexual assault is not a common problem. Well, we've just seen that actually it is a pretty frequent problem. That it's most often committed by strangers, actually false. Vast majority of the time, it's someone known to the victim. That women somehow ask for it, either in the way that they dress or the way that they behave. Of course, these rape myths are only victim blaming, okay, without good reason. That women should avoid being alone in the dark or in deserted places. Again, we've just looked at the fact that only a minority of rape cases actually occur in situations like this. That women somehow derive pleasure from being a victim. In fact, being a victim of rape can lead to anxiety disorders, depression, in some cases, post-traumatic stress disorder. And that women lie about sexual assault. In fact, rape is far more likely to go unreported, okay, than it is to be a false accusation. Only a very, very tiny minority of accusations are false. That only women can be raped, of course, not true. Anyone can be raped. The rape is always violent. It involves physical force. Also not true, victims to rape respond in different ways. Sometimes they will completely freeze up, and that way they don't fight back, and so there's no signs of physical struggle or physical force having to be used by the abuser. It's not really rape if someone says yes first and then changes their mind. Of course, also false. Consent can be revoked. And then prostitutes, sex workers can't be raped. Only young people get raped. Only attractive people get raped. You can't be raped by your husband or partner. Again, all false. Again, anyone can be raped. In cases, even the elderly are raped. Yes, young females, early to mid-20s is the most frequent victim of rape, but anyone can be a victim, of course. When we review all of these rape myths, they really fall within one of these categories, either those that blame the victim, those that somehow exonerate the perpetrator, those that imply only certain types of people can be raped, and then those that doubt the validity of rape allegations altogether. Now, when trying to explain why rape myths are so persistent, there's some light that can be shed from social psychology. First of all, the belief in a just world hypothesis. People generally like to believe that the world is a just place and that bad things only happen to people who somehow made bad choices, okay? It makes it easier, of course, to go about your own living and feeling safer in society and so on, believing in that. If you believe that, if something bad has happened to someone, then they somehow must have asked for it or been stupid or reckless in some way. And then attribution bias, really linking here to blaming the victim and exonerating the perpetrator. Now, there's a number of different types of attribution bias, okay? Falsely attributing blame elsewhere. But for the purposes of this, the main one is the fundamental attribution error, when generally people tend to put too much importance on the role of personality traits and don't consider situational characteristics. So the go-to example in social psychology is when you're driving on the road and someone pulls out in front of you, for example. You immediately think, well, they must be a stupid person or a bad driver. You immediately go to some label that you can apply to them, okay, that it's because of their personality traits, okay, some, consistent feature of them. You're less likely to consider situational characteristics like maybe the sun was in their eyes or some of these other things on the road. And if it was vice versa, it's not the same, right? If you accidentally pull out in front of someone, you don't say, oh, I'm an idiot, I'm a terrible driver, and think that that's, a stable characteristic. You usually go to some situational explanation, okay, that the sun was in your eyes or, you didn't see because of this and so on. So in the case of rape myths, what this would be saying, of course, is that quite often people don't consider the situational characteristics that might lead to sexual assault, and they think that there must be certain traits within victims of sexual assault that contributed to their likelihood of being victims. And then cognitive schemas. When we think of victim, when we think of perpetrator, there's a category of information that lights up in our heads, right? It's been put together through our experiences, what we've been exposed to, stories we've seen in shows, the stories we've heard about, and so on. And it's also full of stereotypes and generalizations, okay? People have a kind of general idea of what they think a rape victim is, what a rape victim looks like and features, and the same also with a offender. I'll come back to this when we talk about juries later in the course, but I'll say that men are significantly more likely to believe in rape myths than women are, and older adults are far more likely to believe in rape myths than younger adults as well. Now, if we look at men who commit sexual assaults on adult female victims, there are some common characteristics. Now, there is a lot of variation for this type of offender, okay? What I'm talking about here are generalizations, okay, that are frequently found across studies. But it certainly is the case that the majority, probably around 2/3 of rapists are 25 or younger. 46% under the age of, between the ages of 18 and 25, and then 17% under 18 in this study. But it certainly is the case that men over 25 are less likely to commit rape than those younger. There is quite often a history of criminal activity. It might be for some other impulsive, violent crimes, maybe petty thefts, maybe robberies, maybe physical assault, maybe other sexual crimes. They're very often of low socioeconomic status and have low education attainment. Also, a pretty unstable work history. And unsurprisingly, they endorse traditional male-female sex roles and have hostile attitudes towards women. Then part might be influenced by some adult experiences in relationships and so on, but also that usually began quite early. Usually with those who commit sexual assault, their negative views of women developed pretty early in their development. Okay, so they likely came from a household in which maybe the male was violent towards the female, or in which negative views against women were openly said. And they quite often believe that violence against women is acceptable, and then score high on psychometric tools for measuring masculinity. Unsurprisingly, they endorse rape myths. They quite often have very early sexual experiences, but are unsatisfied with conventional sex. And with the exception of psychopathy and antisocial personality disorder, they very rarely have a mental illness or a mental disorder. So to put this in perspective, okay, about 40 to 50% of rapists are psychopathic. We have a whole week on psychopathy later in the course, but think of it as an extreme personality disorder, okay, that highly predicts recidivistic offending, reoffending. In comparison to child molesters, about 10 to 15% are psychopathic, which is more like the norm for forensic populations. If we looked at a random sample of prisoners from a whole range of crimes, about 15% would meet the standard for psychopathy. So when we talk about rapists, we're talking about rates much higher than the norm for prisoners. There's a popular typing system by Groth and colleagues that splits the majority of rapists into one of these three categories. The first is the anger rapist, who's motivated by anger against women. So they might be the rapist who inflicts some bodily harm on the victim during the attack. There might be some humiliation, maybe even some torment. But their hostility towards women is really what's driving their criminal behavior. The second is the power rapist, who wants to feel in control, who is looking for a power trip to prove their dominance over the victim. And then the sadistic rapist, taking up here about 5%. So when we talk about sadism, what we're talking about is getting sexually excited from inflicting pain upon someone else, right? And usually a sexual sadist only gets sexually excited, okay, by inflicting pain or watching pain be inflicted on someone. They don't get aroused, okay, by conventional pornography. Now, well, this is quite a popular typing system. It certainly comes with problems, the most obvious of which is that power is pretty much always part of the motivation, okay? So splitting a rapist into either the power category or some other category is going to be difficult because there's going to be some overlap. Just like when we talked about the Holmes and Holmes model of serial killers, and I said that quite often there's a power element to it. And so having one type just for power is, quite difficult in reality. The other issue with this model is that it doesn't help forensic psychologists with treatment, okay? There's no evidence that those within the anger category respond better or worse to different forms of treatment than those in the power category, okay? So it doesn't aid with rehabilitation. So a far more popular model amongst forensic psychologists is the revised rapist typology, the third version currently by Knight and Prentley. This is much more useful because different types do respond differently to different types of treatments. Okay, and so we can tailor interventions based upon the type in which one falls. Now, what this is arguing is that there are two main pathways, okay, that lead to one committing sexual assault. The first here is an anger pathway, again, talking about hostility towards women being the driving force of the criminal behavior. And then the second pathway is a sexual pathway, okay, that it's driven by some deviant sexual fantasy that the perpetrator wants to live out, okay? Now, in the anger pathway, there's two different types here. The first one here, the pervasively angry type, is someone who is just generally angry and hostile in basically all domains of their life, okay? They're hostile in their day-to-day interactions, okay, no matter who it is that they're dealing with. And they have hostility towards women at large, okay? It's not really specifically targeted at one particular individual, okay? They have pretty long-lasting negative attitudes towards women and are hostile in all of their interactions and are happy to take their anger out on just any woman. The vindicative type, on the other hand, has a more situation-specific rage, okay? The anger is usually following some humiliation or some triggering event, maybe a breakup or losing a job or something that's, damaging to their ego. It's usually following something such as this. And the rape is a way of compensating for their current insecurities. It might be targeted at the victim who they think is responsible for causing their insecurity. So maybe if they've just been broken up with, okay, they could be raping their ex, for example. But it doesn't necessarily have to be, okay? It could be displacing the anger elsewhere, okay? It could be the case that they were humiliated by their boss or by an ex or by someone else, and they're displacing their anger on some other victim, okay? But it's still situation specific, the rage, because it's following some particular event, right? In contrast to the pervasively angry type. And then the sexual pathway really gives rise to three types. The first is the opportunistic. So this is someone who is, as it says, opportunistic. They have very little impulse control, will act upon their urges, and if they see someone to take advantage of, they seize on that opportunity. Okay. So this is someone who Freud would have said is ruled by their id, right? Operating on the pleasure principle. They want what they want when they want it without any regard for others or the consequences. They're not thinking ahead. Usually someone who has pretty low IQ, poor executive functions, okay, acting on the moment on their current urges. And the victim really could be anyone who's in a vulnerable position, okay, anyone they can take advantage of in that moment. And then the sexual fantasy type, they have some deviant sexual fantasy. It's not sadistic. It's not about inflicting torture or necessarily physical pain, but maybe they have a fantasy that involves rape that, is to do with power over the victim, their dominance over someone. They have some sexual fantasy, okay, that is what's driving the rape. And then the sadistic type is similar, but it's just the fact that the fantasy is sadistic in nature, okay? It's about inflicting bodily harm, potentially torture, right? The sadistic type, of course, is also the one most likely to escalate to sexual murder as well, okay? Now, looking at the evidence from the crime, if you like, there might be some overlap in characteristics with the sadistic type and the pervasively angry type. Both are likely to inflict bodily harm and, more physical force than necessary, more physical pain than the others on the victim. Okay, both of the pervasively angry type and the sadistic type. Okay, is there any questions so far? Are these 5 different types clear? Yeah. Okay, good question. The question was, is there a type more likely to be psychopathic than the others? I don't know research on that off the top of my head, but what I would believe would be that the pervasively angry type and the opportunistic type are clearly capturing quite a lot of psychopathic characteristics, slightly different ones. This sexual sadistic, also pretty likely to be psychopathic. I think all of these have a good chance of being psychopathic. The vindictive is maybe the one lower in probability because it's more situation specific, okay? But I think they all will likely have quite high scores of psychopathy. Yeah. In terms of the behavior at the crime scene, both will inflict physical harm often on the victim. Yeah. I'll tell you some research on victim behavior, okay? Because it gives some insight into the psychology of the offenders that we're talking about. There is research on how likely it is that a rape will be completed, that the rapist will climax, based upon victim behavior. The victim can choose to fight back, the victim could freeze up, or the victim could cry and plead for the rapist to stop, okay? Statistically, the behavior that increases the probability of the rape completing the most is crying and pleading, okay, for the rapist to stop. Now, of course, that's not about victim blaming at all, okay? No one knows how they might respond in such a traumatic scenario. and you certainly can't blame the victim for however she responds, okay? But I'm telling you this because it tells you something about the psychology of the rapist, right? If what we're finding is that pleading for the rapist to stop, crying for help, is the behavior that most excites the rapist and most likely leads the rape to completing, then that tells you that we're dealing with someone who, well, is getting off on the cries for help, the humiliation of the victim, who's really enjoying this power trip and dominance over the victim. Okay, so that's kind of the types of sexual assaultists and some common characteristics. I also want to talk about child sexual offenders. Now, first of all, there's a distinction to be made between pedophilia and child molestation. Pedophilia is a mental disorder listed in the DSM. It refers to a preference, a sexual preference for children, not yet at adolescence, so not yet at puberty. So we're talking about, children less than about 11 years old, okay? Children who haven't reached puberty yet. It's a disorder, okay? It's not in itself a crime unless one acts upon it, okay? Child molestation, on the other hand, is a crime, okay? That's sexual assault against a child. So it's not the case that all pedophiles are child molesters, and it's not the case that all child molesters are pedophiles, okay? In fact, the majority of child molesters are not pedophilic, okay? Most child molesters do not have a stable sexual preference for children. It might be the case that they're opportunistic, taking advantage of the vulnerable, and in some cases, that might be children. In fact, according to the research, less than half of child molesters are actually pedophilic. There's then two types of child molesters. You have intrafamiliar child molesters, those who molest children within the home, so relatives, quite often their own children, okay? But it could be other relatives, nieces, nephews, for example. And then extrafamilial child molesters, those who molest children outside the home, those that they're not related to. It could be a stranger, kidnapping a child from the park, but it could also be a daycare worker or a babysitter or someone who has some access to children as well, but someone who isn't a relative. The extrafamiliar child molesters are significantly more likely to be pedophilic, okay, than intrafamiliar child molesters. It's more likely the case that intrafamiliar child molesters are opportunistic or some other characteristic that we'll come to, okay? But it's not very often the case that they have a stable preference for children, okay? That's more likely for the extrafamilial child molester who targets children they're not related to. Okay, I'm going to play a video for you, okay, before I go any further. That'll bring up some issues that we'll talk a bit more about.
When I first started meeting pedophiles and working with people who were genuinely pedophilic, I think it took about 2 weeks to grow the skin. And I tell all my students this, is that it takes time, not nearly as much time as one would think. We give a person different kinds of tasks: verbal tasks, nonverbal tasks, spelling, reading, memory, ability to control their own thought patterns. We found several, very important things. The largest main one was IQ. It turned out that people who are sexually interested in children 10 to 15 IQ points lower than average. Then we had physical height, again, part of routine, medical checkups. People who were arrested for offenses against children were about 2.5 centimeters on average shorter than people who were arrested for sex offenses against adults. 2.5 centimeters in physiological terms is very, very large. It's about double the effect that we would get if a woman smoked when she was pregnant. The next big one, handedness. Roughly 10% of the population, 12% of the mainstream population is left-handed or non-right-handed technically. But it was about 30%, 35% of the pedophiles. The only other groups that have non-right-handedness rates that high are schizophrenics, bipolars, and people with autism. Whatever it is that's wrong, there has to be a piece in the brain, and whatever piece of that had to have been developmental. We were looking at first really in the surface of the brain. The surface of the brain is composed of what we call gray matter. It's where the major differences are. It wasn't until a few days after that we found something that none of us thought. There were huge differences in white matter. And all sat and we're scratching out white matter. Nothing's ever in white matter. It's cabling tissue that puts the different parts of the brain work together. How could this possibly lead to pedophilia? It just made no sense to us. Then it was just one of those times, where a scientist gets lucky, which does not happen a lot. At my data, and I was pulling my hair, I could not make any sense of it, put it down, another stack of papers on my desk that I had to read. And all of a sudden, one explained the other, and it just all of a sudden made sense. Men, when they see somebody attractive, naturally widen their stance, their voice goes down a little bit. Women, when they see somebody attractive, start touching their hair, start accentuating their, all completely unconsciously. When we see a kid, our voices go up, we take on an avuncular turn. Oh, are you lost? Can I get you? Where's your mother? Instead of evoking the responses that come with perceiving a kid, it's as if it's cross-wired, and when it sees a kid or perceives a kid, it's triggering the sex response system instead of the parental nurturing system. A literal cross-wiring. Nobody is in control of or no man is in control of whatever it is he's interested in or not interested in. I think just growing up gay made me naturally sympathetic to that story because, I grew up being interested in different things from everybody else. There do exist the psychopathic, it's very easy to call them evil. There is nothing we can do to help keep society safe except to keep these people out of society. They exist. But for the great majority of them, there's other pieces to the story. These are people for whom there's no reason to think that they did anything inappropriate, that they ever committed any kind of an offense, but they come into a psychologist with, Doc, I got a problem. They can't tell anyone, they can't tell their friends, they have no one to go to for support. There are many situations in which a mental health professional, psychologist, psychiatrist, whoever, is required to report this to protect society. But of course, the pedophiles are in society. They know that this is the regulation, and therefore they don't come in the first place. We should be creating situations where they can come in, remain anonymous, and receive sex drive reducing medications or counseling or group therapy or whatever is appropriate to the situation we're in. Unfortunately, the automatic gut reaction that so many people have to this person is evil, the correct thing to do is remove them from society forever, is actually making things worse rather than better. We need to be able to be dispassionate and clinical and think rationally about the situation rather than giving in to our first instinct, which is usually shoot first and ask questions later, which is unfortunately a great deal of public policy.
So the video raises the point over non-offending pedophiles and the best way of dealing or treating with such a population, which is an issue I want to come back to probably next time. But it also raises the issue that if pedophilia is something to do with the brain having gone wrong, then to what extent is it a stable preference, or to what extent can it be changed? Some research on this issue has compared it to the criteria for a sexual orientation to see if it technically meets this definition. So first of all, I'll discuss what it means to meet this definition of a sexual orientation. First of all, it needs to have an early onset in life, typically in the early teens. Second, it needs to be stable over time. So it's not the case that one sexual orientation, okay, changes or fluctuates, okay, based upon the age that they are. It's something that's stable across time. But also it's something that can't be modified through intervention, okay? In the previous century, there was many forms of aversion therapy, conversion therapies, electric shock therapy, okay? Frequent up until the 1990s, okay? But back when homosexuality was illegal, quite often men were forced to undergo electric shock therapy, okay, if they had been arrested for homosexuality, in which they would be forced to watch gay pornography and then they would be electrocuted during it, hoping that the negative association would turn them straight. All of these interventions failed, okay? It's not the case that these sorts of interventions can change one's sexual orientation. There's a number of religious conversion programs across the US, okay, that claim to be able to change sexual orientation, but I'm telling you that the data doesn't back up the claims being made by these programs. Of course, you can find some single cases, okay, people who say that they were helped by these programs if they felt as though that they wanted to be helped by these programs. But if you look closely at these cases, it's not really the case that their sexual orientation has changed, but it's the case that they're ignoring, okay, their natural sexual orientation. And lastly, that there's a high degree of correlation between sexual interest and romantic interest, meaning that the sex that you're attracted to is also the sex you're likely to fall in love with, okay? So if we compare this to pedophilia, does pedophilia technically meet the definition? Well, yes, it does have an early onset in life. It does typically emerge in the early teens, okay, much like other sexual orientations. Second, it is stable over time, okay? It's not something that changes as one gets older, that goes away, and it's not something that can be changed for interventions. We'll later in the week talk about interventions, and we'll talk about the fact that, yes, there can be success in reducing reoffending. You can teach empathy and visual perspective taking and teach people to take responsibility for their actions, thereby making it less likely they'll offend again once they're released from prison. But actually changing their sexual preference, there's no compelling evidence to suggest that interventions do this. And then lastly, there is a correlation in terms of pedophiles often obviously being attracted to children and then also reporting that they've fallen in love with children as well. So technically, pedophilia would meet the definition for sexual orientation on these points. Another point to bring up is this concept of emotional congruence with children. So it's a perceived or actual emotional and cognitive bond with a child, okay? It doesn't mean that the offender thinks of themselves as a child, okay? Or that they're necessarily childlike. That's not what it's referring to. What it's referring to is that they are more likely to seek out close emotional bonds with children than they are with adults. And they're more likely to find these satisfying than they do with adults, okay? So they're more likely to find bonds with children, both cognitive and emotional bonds, as more satisfying than such bonds with adults. It's an important concept because it's a significant risk factor for reoffending. Child molesters who report higher degrees of seeking emotional congruence with children are substantially more likely to reoffend if they're released than child molesters who score lower on seeking emotional congruence with children. And it's more prevalent as a predictive issue amongst extrafamilial perpetrators rather than intrafamilial. But that's not surprising, okay, because I already told you that extrafamilial are more likely to be pedophilic than intrafamilial. And obviously this has got a lot to do with pedophilia, okay, that it's more likely pedophilic child molesters who will be seeking emotional congruence with children. There's three main models proposed to explain seeking emotional congruence with children. Okay, why child molesters or pedophiles might do this. The first explanation is the blockage model, which argues that because of impaired social skills or difficulty forming relationships with adults, these individuals turn to children to form bonds with out of loneliness or out of desperation because they don't have these meaningful bonds with adults. So instead, they seek out bonds with children instead. The second explanation is the sexual deviance model, which is simply that you're more likely to seek out a close emotional connection to those whom you're attracted to than those that you're not. If you're attracted to someone, you typically project some positive characteristics onto them. You typically want to get to know them. You typically want to get closer to them emotionally and so on. Whereas that's less likely to be the case with those you're not attracted to. So that would be why they're more likely to form these bonds with children than adults if they're pedophilic and have a sexual preference for children. The second explanation is the psychological immaturity model, which argues that because of impaired cognitive functions, impaired IQ, or because of impaired social skills, the offender relates more, they have more in common with the child than they do with adults, okay? And so because they find it easier to identify with children, that's thereby why they're wanting to form close bonds with children rather than with adults. Now, in a 2014 study by McPhail and colleagues, they interviewed a sample of child molesters to see what pathway they could find evidence for in their stories, okay? Which of these models best explained their pathway to offending. They found reasonable evidence for the blockage model, okay, that there was a number of offenders who had a story that pretty well fits this explanation. They found very good evidence for the sexual deviance model, okay, that a good number of those in the sample had stories that reflected this explanation. And in this study, they found basically no evidence for the psychological immaturity model. There was no story that really fit this model. Now, of course, it's not the case that there's no offenders, okay, that this model might explain, but it certainly seems to be the least significant, okay, in terms of explaining this sort of offending. The other two seem to be more substantial explanations in terms of a wider number of participants in studies being explained by these two models. Okay, questions on anything I've said so far on emotional congruence, these three different models, the research I've just said right there? Yeah.
So kind of use of sexual deviance model. Can you give an example?
Okay. So, I mean, the sexual deviant model is that the one that you're attracted to is the one you want to get close to. Okay. So that's why they're forming close bonds with children, because they're attracted to children rather than with adults. So, you know, it would be similar, for example, in the case of a heterosexual person, right? If they're feeling attracted to one particular person, it would, according to this model, be the case they would want to seek out an emotional bond, a cognitive bond with that person, rather than someone they weren't attracted to. That makes sense. Anything else? I'll talk a little bit more about some of the differences, okay, between the different types of child molesters. The fixated or preferential child molester is someone who has a stable preference for children. So someone who's likely pedophilic, okay? This is their sexual preference versus the regressed or situational child molester, okay? Who's essentially a non-pedophilic child molester, okay? Someone whose preference in children is situational, okay? So obviously it's the case that the fixated preferential child molester is more likely to be extrafamilial, more likely they'll seek out victims outside the home. Of course, there's some exceptions, okay? There's some pedophilic offenders who do get married and do have children, who do abuse their own children, but they're the exception, okay? So most of these offenders will be targeting victims outside their relatives. And then the regressed situational child molester, who's less likely to be pedophilic, more likely to be intrafamilial, so more likely to be targeting their own relatives, maybe their own children. It's not the case that they have a stable preference for children. It's situation specific, situational. So it might be following humiliation, or once they're drunk, or once they're getting divorced, following some sort of triggering events, okay? And there are some differences, okay? So the regressed child molester, more likely to be under the influence of alcohol when molesting a child than the fixated child molester. The regressed child molester is more likely to feel guilt and remorse than the fixated child molester. Maybe once they sober up or had time to think about what they've done. And then Holmes and Holmes adds a sadistic type, okay, who doesn't necessarily have to fall within just one of these or any of these. So obviously someone who gets sadistic pleasure from torturing a child, from physically harming and sexually harming a child. And again, this is likely the type that might escalate to homicide. Any questions on these differences? Yeah. The fixated, yes. Yeah, more likely to be targeting victims outside the home. Anything else? I'll say a little bit about juvenile offenders, but the truth is the research on this is pretty light. We do know that they typically target victims younger than themselves, usually younger siblings or younger family members, like younger cousins. We do know that they're very often victims of sexual assault themselves. And we know that there's high rates of learning disabilities amongst this group. But I do want to stress the fact that these findings are from a small number of studies, okay? Usually when I tell you about common characteristics of offenders, I'm summing up a large body of research, okay? I'm talking about at least dozens of studies normally that I'm condensing. In this case, I'm talking about one or two, okay, that I'm summing up. So it's a much, much smaller amount of research. The reoffending rates differ from study, but about 5 to 20% recidivism rates. Some risk factors for reoffending is if the sexual assault is violent in nature, more likely then that individual will reoffend. And a higher number of offenses as well predict more likelihood of reoffending. Also, it's not uncommon for juvenile sex offenses to be committed by groups. In fact, according to some research, about 2/3 of these offenses are committed by groups. Those committed by groups more likely to be violent than those with a single perpetrator. And group offenders are less likely to have being victims of sexual abuse than single offenders. They're also typically more sociable, less impulsive than single offenders. And grip offenders are less likely to reoffend also than solo offenders. There's a couple of other concepts I'll briefly mention, hebephilia and ebophilia. Now, these are not recognized mental disorders listed in the DSM, okay? Pedophilia is, these are not, but they are still terms quite often used in the literature. So pedophilia, remember, refers to a sexual preference in one who hasn't yet reached puberty. Hebephilia refers to a sexual preference in someone who's undergoing puberty. Okay, so someone who's between the ages of about 11 and 14. And then ebophilia, a less frequently used term than hebephilia, but is a sexual preference for someone at the end of puberty who isn't yet of legal age, okay? So we're talking here about 15 years of age. Now, you know, when the DSM-5 came about, which was the most recent edition of the DSM, in 2009, there was, as usual when the DSM is about to be published, a debate on, you know, what should be changed, what should be removed, what should be added. And there was some argument for adding hebephilia to the DSM-5. It was debated, fairly controversial, okay? In part because there might be a fear that it might be misused by the courts, for example, because the vast majority of those who commit statutory rape, who sexually assault a teenager, are not hebephilic. They don't have a sexual preference in teenagers. They were opportunistic and taking advantage of someone who was vulnerable. And it's a difficult thing, or it would be a difficult thing also to prove, okay, a sexual preference for this teenage age. But it's controversial because, you know, the standard for being listed in the DSM is not very high. The DSM is actually pretty exhaustive in the number of disorders being listed, right? So long as it's abnormal, basically, it's going to be listed there. And so to not list hebephilia is in some way suggesting it's not abnormal, okay? So that would be the controversy of it, in which there isn't really necessarily a good side to be on in the debate. Pretty soon, the DSM-6 will be in the process of publication, and again, there will be conversations over what to include. And I imagine that the debates will occur again, that there will be some arguing for hebephilia, but I don't believe enough has changed, and I think the outcome will be the same. It won't be listed in the next edition. I also want to talk about female sex offenders. Minority, of course, of sexual offenders, about 2 to 5%, but still a significant number, and so still worth studying, of course. They are less likely than male offenders to have psychopathy or antisocial personality disorder. But they too are likely to come from low socioeconomic backgrounds and have low levels of education attainment. They are significantly more likely to have borderline, avoidant, or paranoid personality disorders. And well, it's the case that male child molesters were often sexually abused as well. It's even more likely to be the case with female offenders, okay? But that's true across the board, okay? For all types of offenders, the likelihood of the female victim having been victim herself of sexual abuse is higher than the male offender. And female offenders, quite often very low levels of self-esteem as well. Which again is more tied anyway to general offending, okay? Female offenders do typically have low levels of self-esteem. That's not the case necessarily for male offenders. Now, probably the best way of categorizing female offenders is what I have here on the slide. The first type in this model is called the heterosexual nurturer, elsewhere sometimes called the teacher-lover offender. So this is the offender you've heard about in the news before, I'm sure. It's the high school teacher who has a sexual relationship with her student, okay? So we're talking about a female high school teacher, inappropriate relationship with a male student. She's usually in her early 30s. She's usually had a number of unsuccessful relationships in her past, quite often been a victim of domestic violence. And very often she characterizes this relationship with the boy, the high school student, as being mutual love, as being the most meaningful relationship she's ever had, as being the most satisfying relationship she's ever had. And so she's not seeing it as an offense. In her view, it's a healthy relationship despite the massive age difference. The second type is a non-criminal homosexual offender, elsewhere called the male accompanied or male coerced offender. So this is simply the female offender who has a male partner. They might be equal partners, or it might be the case that they are being coerced into it somehow, okay? But either way, they're under the influence quite often of a male offender. And in most cases, the victim, of course, is female, okay? Because the main person driving this offense is the male partner. The third type is the homosexual criminal offender, who's in this for financial gain, okay, for economic reasons. So someone who is running a illegal prostitution ring of those underage or some child trafficking situation. Now, the category says homosexual because in most cases, the victims are female. But of course, that's not always the case. Okay, young boys also can be victims to sexual trafficking and these other sorts of situations. But remember, this model is explaining sexual offending here in the US, okay? There are some places in the world in which these sorts of sexual trafficking rings are more likely to include male victims. It's less likely to be the case in the US. Well, it does happen. Usually the victims are females. But if the victim was male, the offender would still fall under this category, okay, despite the label saying homosexual in its title. The fourth category is the female sexual predator, elsewhere sometimes called the predisposed offender. The one who has a number of offenses, quite often recidivistic, meaning that they reoffend, so there's a number of offenses. But it could also be a number of offenses against the same victim, or it could be multiple victims. So this could be someone who is sexually deviant, and so who is targeting young victims because they have some deviant sexual fantasy themselves. It could be that they are persistently abusing their own children or their own child, or exploiting their own children in some way. And then the fifth type here is the young adult child exploiter. So the offender is a young adult, okay, late teens, early 20s, and they're targeting usually younger relatives, okay? Usually younger siblings, but it could be younger cousins, something such as this. This is the category with the youngest victims on average, okay? Victims of this offender are about 7 years of age on average. And there's no specific gender tied to the typical victim of this offender, okay? They're quite often male, they're quite often female. The young adult child exploiter was quite often sexually abused herself. And so it might be the case that, you know, she's taking out what she learned or what happened to her on a younger relative, okay? Taking advantage of someone more vulnerable. And then lastly, there's the aggressive homosexual offender who's really driven by anger, rage, wanting to take advantage of someone in a vulnerable position in order to make themselves feel better. And this is the offender who has the oldest victims on average. Okay, this includes the elderly, maybe the elderly that they're caring for example, or they have some connection to, or it could be someone who is disabled, again, in a vulnerable position. So it's not necessarily children who are victims, okay, within this category.